Hi there, this is Todd Welter. Thanks for coming onto our website. I'm going to do a Quckinar here for you on healthcare reform. Lot going on in healthcare reform these days. Let's see here. The reason, of course, is that healthcare spending in this country is out of control. I mean, we're spending $2.6 trillion on healthcare. 18% now, 18% of the gross domestic product. That is unsustainable, the increase, although it is slowing down a little bit. And you know, you could argue that the reason for that is that the baby boomers are getting older, and so we have this kind of wave of older folks moving through the healthcare system and moving through the most expensive part of the healthcare system. That's certainly part of it. The other part of it is, you know, technology, use of medications, and all kinds of other things. So for those of us that have health insurance and have health care, we're living better and longer. But there's still an awful lot of people out there that don't have health insurance for one reason or another, and don't have the best, most efficient access to care. I think you could argue that most people have access to care, but it's in a very, unorganized and very inefficient manner. A lot of, go into the emergency room for primary care services and stuff like that. So the goal of allowing everyone to have health insurance is a good one. Just it's a matter of how do we go about it. So I thought I'd go through this with you. Having said that about the healthcare costs and the 18% or so of the gross domestic product, I think it should be pointed out that 3% and growing is the percentage of what it costs to send our kids to college, something that near and dear to my heart right now. So the SGR, another part of this is the SGR. So it's kind of interrelated, the sustainable growth rate for Medicare. We keep kicking that can down the road, and Congress has not allowed the SGR to go into place, which is good, but Congress also has not gone and fixed the SGR. We're now at a point, because we keep kicking it down the road instead of fixing it, we're now at a point where the SGR is going to be about close to 30% cut if it ever goes into place. So huge numbers. A 30% cut in Medicare reimbursement to physicians would be catastrophic to have the ability for old folks to find a doctor. It's hard enough now. It'll be just terrible if that goes into effect. So the underinsured and the uninsured are huge numbers. Here in Colorado, where we are, there's almost 1 million uninsured in Colorado. And there's 675,000 underinsured, and these are numbers from 2011, so it's a couple of years old. But still, I mean, enormous numbers. 12%, again, just using Colorado as an example, and Colorado is it's probably in better shape than a lot of states. 12% of Colorado residents report not having no usual source of care, so no home or no primary care physician per se. Frankly, I think there's an opportunity here for physicians. It just, with all changes, there's winners and losers. I think that the game, if I could call it that, is changing, but there's still lots of opportunity here. A lot of people coming into the system. If healthcare reform or some type of healthcare reform goes into effect, there's no question that there'll be more people insured. There's no question that there'll be more customers, and in any industry, including healthcare, as odd of an industry that healthcare is, that is a good thing. It's just we're going to have to play this, and again, for lack of a better way to say it, we're just going to have to play this a little bit differently. So healthcare reform, again, 30 million people are going to join the healthcare or insured if it goes into effect the way it is right now. And I mean, what does that mean to your practice? If 30 million more people, then certainly they're not all coming to your practice, but 30 million more people are going to have health insurance. it really is a great opportunity. It's a daunting number. Some of the things that might happen on the primary care side are, physicians will tend to go up market over time, I think. PAs and nurse practitioners will have more responsibility, and I think that's a good thing for everyone. I mean, even today, it's rare. It depends on the market, I guess, but in a lot of markets, it's rare for, a well child to see the actual pediatrician. It may be rare in some markets for a well woman exam where you would actually see the OBGYN, the doctor, and in fact you would see a nurse practitioner or a PA instead. So, it's kind of already happening. And it may not be a bad thing. I mean, doctors go up market and do more intensive services that could pay better. Those sorts of things. I frankly think that the days of fee-for-service as the major driver in healthcare reimbursement are probably coming to an end. There's a lot of very unique and I think some really good ideas out there on how to do compensation in a better way. So the way healthcare reform is supposed to work is, if in fact it goes into place, is that they're going to raise the federal poverty level. I'm sorry, that's probably not exactly right. What they're going to do is they're going to supplement a person's ability to buy health insurance, and that number is going to go higher. So it's going to be at 100, at least the proposal as of now is 133% of the federal poverty level. You'll be able to get Medicaid, and then there'll be other stages where the government is going to help a person or individual or family to buy health insurance. So there'll be like tax incentives and stuff like that. And some of those numbers are quite high, where they're going to have, a family of 4, for example, could make as much as $90,000 a year and still get some kind of assistance from the government to purchase health insurance. Now, what's interesting about healthcare reform is it's a requirement for everybody to have health insurance. Now, the way they're going to do that is they're going to create benefit exchanges or healthcare benefit exchanges state by state, so it'll be run by the states. Some states are going to do this whether the Supreme Court acts and throws healthcare reform out or not, but each state will, in theory, would come up with a health benefit exchange where it's sort of an open marketplace where someone could go onto the health exchange and purchase health insurance. And again, depending upon their income, they might be able to get some assistance on purchasing that health insurance from the government. Again, not a terrible idea. I mean, kind of what will be interesting about it will be, though, is if lots of companies go on this exchange and have a health plan, you would think that the benefit structure of that health plan would be somewhat generic or homogeneous between the plans. So how does a health insurance company differentiate its product within the exchange? I'm looking forward to seeing how that's going to work. The other thing is, as part of healthcare reform, and there's been a lot of chatter about this, is that it'll be guarantee issue. In other words, no pre-existing condition. So anyone, no matter what your health status is, can buy health insurance. That's part of the problem with health insurance today, is it's as an individual, through a group plan you could purchase it, but as an individual you can't purchase health insurance if you have a pre-existing condition. Health insurance companies, just like all of us, even as individuals, want to mitigate their risk. And so if you have a pre-existing condition today, it's very, very difficult, if not impossible, depending upon the condition, to buy health insurance. So one of the things that will make health care reform work is they're requiring health insurance companies to do what's called guaranteed issue, where if you can pay for it, they will sell it to you. They have to sell it to you. The trouble with that, though, is if they force us all to have health insurance, which is exactly what's in front of the Supreme Court right now, that's all great. But what's the penalty if you don't? If the penalty for not purchasing health insurance is too low, then we have a problem. Then we have what's called moral hazard. So when you combine the two things together, if you have guaranteed issue and a low penalty for not having it, Then you have moral hazard, which means that when I become sick, I'll pay the fine. Let's say the fine is $1,000 or something like that a year. If I become, it makes sense for me to pay the fine, right? Because my health insurance premium would probably be higher than that. If I become sick, God forbid, then I would go purchase, or somebody in my family, I would then go purchase the health insurance at that time. They can't deny me because there's no pre-existing condition clauses anymore. It's illegal. But it's not sustainable. You can't do that. Insurance companies can't have guaranteed issue and a low threshold for people that don't buy it. The whole idea behind insurance is you want lots of well people in the pool, taking on some of the risk. For all those people out there that are going to be sick, our day, unfortunately, will come for us to be sick, and so we want a lot of well people out there paying into it, keeping the overall cost down. Anyway, interesting days ahead we have here. There'll be lots more Quckinars in the future. Thanks again for coming onto our website, and please come on again. Take care.